I want to tell you a bit about the vision and the goals of our project, where we're coming from and where we're going to. And I'll start with this slide that tells you something that most of you will be familiar with already, but if not, it's a telling statistic from studies carried out approximately 10 years ago, telling us that around 3/4 of all mental disorder that might be present in adult life could be first detected if we were smart enough, quick enough and good enough at our collective jobs and we had enough resources to do it by the time people are age 21. So there are very significant and important early onsets of problems and disorders in young people, and very important continuities into adult life with massive consequences in terms of personal cost and societal cost and economic cost. So if we can get in early and do it right, we're doing a very good job for those young people and their families, of course, and we're also doing a very important job for society. So the vision. Start with a kind of specific aspect of the vision, and then I'd like to move on to some of the more kind of inspirational elements to it. Very specifically, this slide tells you about the kind of overall aims and targets of this portal. And you can see that we've divided it into three sort of categories. In the first category over here, you have the statistics about the number of children and young people that we have in this country, 12 million, and around about 1 million adults who have some kind of caring relationship for those children. We're not talking about parents, although many of them obviously are parents like ourselves, but we're talking about professionals like ourselves. We're also talking about youth workers and clergy, policemen. We're talking about social workers, we're talking about nursery workers, we're talking about anybody who has any role or responsibility for a child in their working professional life. And we estimate that to be about 1 million people. At least half of those will be school teachers, of course, as we know. And then we've got the sort of general sort of level. The ONS statistics tell us around 10% of young people will have a mental disorder between age of 5 and 15. Those figures are conservative, I think, and certainly they're conservative when you get into later adolescence. I've discussed that with colleagues such as Robert Goodman. Epidemiology is an interesting exercise, but certainly 10% is conservative. There's another 10%, so that's another 1.2 million. So here you have the numbers, the 1.2 million here with problems, and another 1.2 million who've got significant vulnerabilities and risk factors that mean that much more likely to develop problems, even if you couldn't define a DSM or ICD diagnosis at the time. And then you have, of that group, approximately 40% who would have more specialised level, higher level needs in our community. So it's a notion of the sort of size of the task and the numbers. And what we're aiming to do with the portal is address each of those levels in due course with e-learning and knowledge and development. So I want to tell you a little bit about inspirations and context and the vision, if you like, that supports that notion of how we might improve knowledge and access at all those different points in the system that I've just illustrated. One of the inspirations I like to draw on, and there's a number of really important people in the world and in my life that I've had the fortune to be in contact with and experience, but certainly on a broader stage, Steve Jobs is very relevant, I think, to some of the thinking behind this project and the sort of look and feel that we want to achieve with this project, because this project is going to be about accessibility. It's going to be about how it looks and feels so that people get interested and drawn into it. When they look at it, they can read it and it makes sense to them in a language, and this is very important for those of you who become authors and start writing. The language must be accessible. It must be accessible to the people we're aiming at. It can't be talking about meta competencies, for example, when we're referring to the general public and the universal audiences. And it's something that I will very easily slip into as a specialist and need to be pulled out of and pulled up on very quickly. So, Steve Jobs said, "Have the courage to follow your heart and intuition. Somehow they already know what you truly want to become." So I'll leave that little thought with you. And then an earlier thought, as he was developing Apple Inc. and the first Macintosh computers, we're gambling on our vision. We would rather do that than make Me Too products. Let some other companies do that. For us, it's always the next dream. So there's a bravery and a vision and a wish to do something differently and not just replicate something that's been done somewhere else. And finally, and really importantly, and I really want to pull this message across to you and emphasize this message for all of us in our thinking as we move forward, you have to start with a customer experience and work backwards towards the technology, not the other way. So we are not going to start, and we are not starting, and my colleague Jonathan over here will attest to that, we are not starting with the technology to dictate and define the way our products will look. We're looking all the time about our experience and the customer experience and adapting and defining the technology in the process, and we've been very actively doing that as we've been developing the programme moving forwards. I want to reflect on the impact of technology and how that has an impact on society, the way we think, the way we collaborate, the way we learn. And these three little pictures are intended to draw your attention to 40-odd thousand years worth of human culture and evolution and development. And some key points, when did we first start producing things, as beautiful as this? If I can get a pointer onto it there. Those stunning cave paintings from 40-odd thousand years ago, 30-odd thousand years ago. But what did they mean to people in those days? The people who first developed the technology to be able to draw and paint like that, what kind of influence did they have on the societies in which they operated? No doubt profound, probably very spiritual. We could talk about that for some time. Then in the Middle Ages we have the printing press. Massive revolution in the access and the accessibility of knowledge, of learning, of spinning out the information that fueled in Western societies in its own way the Renaissance and the flowering of knowledge and technology into the latter part of the last couple of hundred years. It's a massive impact. And then of course most up to date we have this notion of the internet and the interconnectivity that's now bringing across the whole of our planet in a way that I still find almost hard to conceive. And there I begin to show my grey hair and my age. But it's really quite an incredible thing. And what kind of impact is that having? And how, my point is, do we harness that within this programme, within this project, within our writing, within our thinking? So we do have new ways of developing learning and the networks that sit alongside learning, and we want to think about those networks and want to think about networks of professionals and how they might link together in their thinking. What we're doing here is freeing knowledge. This portal is going to be open access. It will be available to anybody who logs in and wishes to use it in this country, potentially internationally, that's still to be finalised. But certainly in this country, so it won't be defined by being a health worker or a social worker or a youth worker or a priest or imam. It'll be defined by logging in. And actually we know that children and parents will probably log into it as well, but it was beyond our scope to aim a portal directly at children and parents. That might be for another day. But what we're doing is freeing knowledge, and we're part of, therefore, a broad movement of knowledge becoming more accessible, and I've shown you some of the historical context of that. If you like, open source and wikis. And what we are is a MOOC. Have any of you heard of MOOCs? So this is another new term, massive open online courses. And if you go onto the internet and Google, for example, Coursera, that's been developed by an offshoot of Harvard University. And they're selling, or providing free actually, but trading, as it were, their wares to tens of thousands of people at the same time, getting access to courses that only a small number could have done in the past. That's what we're doing. I want to talk a bit about the current context then for children and young people, which also sits behind the thinking of this portal. Stigma is a huge issue in mental health. I don't need to explain to an audience like this how big it is. I do need to explain to an audience like this. From my experience of what some of you will know, that I worked at the Department of Health for 3.5 years as National Advisor for Mental Health for Children. And it just became very clear to me that stigma is something that operates as much amongst professionals in some ways in a more negative and adverse way than almost it does among some aspects of the lay population. So one might speculate, and this isn't the Department of Health view, this is my view, the way stigma operates in terms of funding decisions for mental health. Why is it mental health always has such low funding? It does not have parity of esteem, as the government would like it to have, with physical health. The stigma is very important, but what sits behind stigma is a lack of knowledge and a lack of understanding fundamentally. People get stigmatized when people don't understand them. They see them as different, and then they either reject them or expel them or attack them. They do all the things that happens when we get prejudice. And I think in some ways mental health, and certainly children's mental health no different in that from adult mental health, I think developmentally sits around the sort of era that cancer care might have been about 50 or 60 years ago, when treatments were not as well defined as they are currently, when the technology and the understanding and the learning around it wasn't as collated and collaborative across networks and across countries as it is currently for cancer care. Outcomes aren't as good and weren't as good as they have become for cancer care. And specifically, people were scared of cancer, and I don't want to hear that I've got cancer. I'd be scared now, but I think it would be different from how it would have been 50 years ago, when actually mentioning the word was almost something that people didn't want to do because they thought they'd get it. And I remember when I qualified as a doctor in 1984, the outcomes for leukemia for children, as colleagues in this audience will tell me much better than I know because they're paediatricians, were terrible, and they've been transformed in that time. We want to see a transformation in mental health that parallels that kind of development over time, and so that in the future people can talk about it in a way that doesn't feel like you're going to catch it when you talk about it. They can know about it. We can develop collaborative and knowledge sharing and developmental networks that empower all of us to make it different for the future, because we really do need to, because there's an untold story here about children's mental health. Those of you who know me well know I could spend probably the whole of today telling you about how poorly provided we are for mental health, how low the detection rates are, how low the adequate treatment rates are around the country, how low the provision is in terms of investment and so forth in appropriate services, and how patchy and variable those services are where they are provided for all sorts of complex reasons. The trouble is that those are the kids, those are our kids, those are the kids who are going to become us in the future, and they're not growing up as healthy as we should want them to be. And we don't compare very well on international comparisons, and we really need to do as much as we can about that to prevent that continuing to be the trend. We should be asking ourselves very serious questions as to why it is that we don't do as well as some of our West European colleagues. They have very similar economies but much lower prevalence rates than we do. And we have to do all of this within a context of austerity. How can we most efficiently do this? How can we most effectively do this for the most people in the best way that actually manages these difficulties? So we need to fit in with the national context. I'm not going to explain this diagram, but this is the DH's helpful diagram about the complexities of the new NHS and care system that's been evolving and developed. And we are going to sit within that and make sure that as many people as possible within that system, commissioners, managers, clinicians, users, carers, understand more about children and young people's mental health. These are the visions and aims of this project. And so, in order to deliver this project, we've developed a program structure which includes these 5 key elements, which I will skip through for you. We have a collaboration that's very strong and part of our overall program with the BACP, British Association of Counselling and Psychotherapists, who are developing Counselling MindED element of the portal. We have the mental health core content, which Dr. Brian Jacobs over here is the lead editor for. We have the Healthy Child Programme, which is the child health programme, which is being added to and refined, and also a specific element of it being developed for 5 to 11-year-olds by Dr. Paul Carter over here as lead editor. We have the development of blended learning for SIP-IAP. Some of you here from the SIP-IAP collaboration, that's more aimed at specialist services. And finally, we have very interesting evidence-based review of e-therapies that's being undertaken for us by the National Collaborating Centre for Mental Health under leadership of Tim Kendall and Peter Fonagy, which I'm sitting on the steering group for. Our programme structure relates these projects to the Department of Health through our consortium, which I'm going to tell you about in a moment. So the Department of Health funded this project and provides steering for this project, and we also relate importantly to our SIP-IAPT leadership team, who is now embedded in NHS England. It used to be called the Commissioning Board. That changed in the last month and will probably change again. The consortium is this. Hopefully you've all twigged that. I think it's a great achievement, and I'm really proud of it that we've managed to bring together so many important colleges and organisations, the GPs, the nurses, psychologists, doctors, paediatricians, psychiatrists, representative of youth and the National Children's Bureau into a consortium simply working together for children. I think that's such an important message, especially at these times of austerity. We must do things together. There's not enough of us to do it all in little silos. So the underlying precepts of the MindED portal, and this is what we want you to feed into your thinking and development of content, is that it will be best evidence-based, it will be driven by quality, it will be informed, crucially, by our customers, ultimately the children with mental health problems who we want to look after, but also our target audiences who are asking to do that in the best way, and therefore focused on the best possible outcome. And those are the precepts that sit underneath and form the basis and pillars for SIP-IAPT, a successful project so far. Managed to attract £54 million worth of government funding, and I was delighted that I could be part of setting up that project when I was at the Department of Health. And those 4 precepts were my precepts. I have a personal ownership of those, and I'm very pleased with them. I won't linger on this particular slide because I want to get on to introducing the team to you. So we have Dr. Brian Jacobs over here. I'll start at the bottom left-hand corner, who's lead editor for the core mental health component of the curriculum project. And next to Brian within that project is Darren Cooper, if you could wave your arm, who's project manager for that project. Then we have Shirley at the back, Shirley Reynolds, Professor Shirley Reynolds, who is lead editor and executive for the SIP-IAPT project, and newly appointed in his role is Ian over here as project manager alongside Shirley. Then we have Dr. Paul Carter over here as editor for the Healthy Child Programme project and the school child part of that, and working together with Paul is our colleague Laura Green over here, who's the project manager. We have myself up here, of course, and then we have Keith Chambers, who unfortunately couldn't be here. He's a wonderful chap, programme manager, chap with great experience and knowledge, brings a wealth of experience from other sectors to here. He's never worked in health or social care before, and he really does help me and all of us understand what it is to keep moving forward, progressing and developing projects and programmes. I wish we had more people like him in the NHS. And then we have Jonathan over here, who's over here from eLearning for Health, who's going to be my colleague who's going to speak shortly, just after me. We are developing our processes and content at speed, and it is indeed, very exciting to do that, and at times a little bit like that. But those of you who will be joining us, we hope you'll get that sense of excitement that goes with that, and actually moving forward and developing processes as we move forward together. Okay, so there's the contact for MindED, and I'll draw this introduction to a close for our vision and our description of where we're going and where we're coming from.